Welcome to another episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan. Now, cholera remains a persistent threat to global health, especially in regions with poor sanitation and limited access to clean water. The Nigeria Center for Disease Control and Prevention, NCDC, yesterday activated a national cholera emergency center following the outbreak of the disease in the country. It also said 53 deaths and 1,528 suspected cholera cases were recorded across 31 states and 107 local government areas, with a case fatality rate of 3.5% since the beginning of 2024. This is even as Lagos state government yesterday disclosed that the cholera death toll had risen to 29 from the previously reported 24 last week, adding that the total number of suspected cases had risen to 579. Director General of NCDC, Dr. Jide Idris, who spoke in an update on the cholera epidemiological situation in Nigeria, expressed fears that the situation might be compounded as the rainy season intensifies. Now, environmental health is crucial in cholera prevention by ensuring access to safe drinking water, proper sanitation, and promoting good hygiene practices. Today on the program, Environmental Officer, Sanitarian EGENE Tijani Eneojo joins us to discuss cholera control and the role of environmental health. Stick around. You're welcome to the studio once again this morning. How are you doing today?
I am very fine. Thank you for always reaching us, especially at this point of emergency.
Honestly, it's really an emergency, and we're beginning to wonder. It has spread to 107 local governments in 31 states. It has become something so scary, especially with the number of deaths that has occurred so far, and it's becoming really scary every day. So, as an environmental specialist, we want you to, first of all, give us insights into what cholera is and how it affects the human body.
Yeah, thank you so much for always having interest in environmental health. Prevention, they say, is
better
cheaper.
Than cure. Oh, cheaper, yeah, definitely.
So, the cholera we are discussing about today is an epidemic. Yeah, it's a bacterial infection that arises as a result of poor sanitation. And people get infected where they consumed water or food that is contaminated with the bacteria, which is Vibrio cholerae. And when they get into the system, it automatically affects the small intestine. And when your small intestine is affected, it gives room for more water to go out of you. And that is what brings about diarrhea, vomiting, abdominal cramps, and thereabouts. So it is the right time for us to discuss about it, so that people should know of what to do when they are feeling some of these symptoms, where to run to, who to seek advice from, and then the preventive measures. Yeah.
So let's talk about the symptoms first of all. What are the symptoms that we begin to see to know that, oh, I may have contracted this cholera, and when should we quickly seek for help?
Now, when you eat food or you drink water that is contaminated with the bacteria, in the next 1 hour to 5 hours, you started feeling unwell. In some cases, it gets to maybe 12 to 5 days. That is 12 hours to 5 days. But that depends on your level of immune system. So when this gets into you, you start feeling stomach pains. Before you know it, you started vomiting. You started frequent visiting the toilet. And this visiting the toilet is not just normal. After between 1 hour, you may visit toilet like 3 times. So once you started noticing this, you should know that you are having a serious health challenges. And then the shit, if you have opportunity, those days where the practice of open defecation is common, you see that this type of stooling is just like the watery stool. You know, when you boil rice, right? The water you wash away from that rice, that is how the shit or the feces will look like at that point in time. That should give you the sign that, okay, you are feeling unwell from different kinds of disease, such as cholera, as we are discussing today. Then you dysentery will come in, and diarrhea will follow. You have abdominal pains, you have general body pain, you have vomiting, and then you have nausea. So these are some of the symptoms you expected when you have cholera. And it is an emergency situation. In this case, the first point to what to do is very, very necessary. So when this thing happens like this, you should seek advice of a professional.
All right, thank you very much. I know you said some people, if it's a situation where, if it was then when open defecation was being practiced. I listened to the Minister of Health this morning, Professor Mohammed Ali Pate, and he's still talking about open defecation as something that's still imminent in Nigeria, and in fact, in most parts of Nigeria. And do you think that it has any, factor to do with the reason why we have a spread of cholera? And is there something that has to do with how rapid it's moving because it's rainy season? What are the environmental factors that is causing this spread like so quickly? We have already 31 states reported cases.
One of the environmental factors is what you just mentioned, open defecation.
Okay.
When you go around your premises, you see a lot of things that happen. And this open defecation is not just ordinarily going to an open space to defecate when you are you want to ease yourself. It is not just to go into the classroom when you are pressed to defecate or go into the gutter. Open defecation goes beyond that. You may have a sanitary facilities such as the toilet, but how do you channel your toilet, the pipe from the toilet? How do you channel it? Where do you channel it to? What majority of people are doing, that is the few that have went to look out for, what they are doing is what we call on-site disposal. Yeah, you have a facilities, but you channel the pipe from your soakaway into the public drainage system. What do you think you are doing? It is still open defecation. So while I was coming here, I took pictures of a place that I went recently, and I saw that place yesterday, and I said, why is this thing happening? A public toilet close to the road channel their pipe from soakaway through the drainage system into the canal. Wow. And this is
water that people might consume.
Yes, and this is what Rwasa is crying about. This is what WASH is all about. Prevention is better and cheaper than cure. But when you build a toilet and you channel your pipe from the toilet into the public drainage, what are you trying to do? You still continue in the problem. The poor sanitation is one of the environmental factors. People do not take sanitation serious this time, and it has been part of them. So a lot needs to be done to reach out to these people to be able to take sanitation seriously. Poor personal hygiene is also inclusive. You may go to this toilet. Many people gone at those days use leaf to clean their bum. When you use the leaf, what happened? There must be remnant of these sheets on your hand. And then a visitor came to visit, and you were asked to go to the pot, because then we have an old fridge. That one, each time you come there, the water is very cool. Then you were asked to go to the pot and fetch water for a visitor. Then mistakenly your finger might enter into the water you are serving the visitor. Remember, from toilet you use your hand to clean your bum. You went to the pot to fetch water, and your finger mistakenly entered the water, and you serve the customer. What happened? In the next few hours, you see the customer started feeling unwell. So personal hygiene is another factor. Climate change contributed to what we are here to discuss about today. The increase in the cholera outbreak. Climate change brings about flooding, and cholera always occur, especially at the early rainy season, because all your activities during the dry season, you poo here, you defecate here, you sit here, you sit here, some people have a special place they go. See my space, as you come, you go there. Every day they keep going there. Then the rain now wash away this surface into the body of water. People are there down the drain making use of this water for drinking, for cooking, for bathing, and do other domestic activities. What do you think? It will definitely affect the lives. And once it affects one, it affects the others. The migration is one of the environmental factors.
Really? Yes.
Now, in Lagos and other part of the states in Nigeria are affected with this virus. How does this rapid transfer occur? People visit the place of that there's an outbreak and go back to another place or take it back to their house. When they come to the house, they share among the family. So transmission of this disease can also occur during what? Migration to urban center. Then population is another problem. When there's an overpopulation in a place, it weaken or it overwhelm the facilities that is meant to contain the human feces or shit. Now, in the family of 10 with one toilet, how do you expect them to cope? Every morning when nature call, everybody want to answer at the same time. And once you cannot answer, you go to some places, you see them using poo. When they finish, they transfer it to the toilet. I was in Lagos some years ago. Do you believe that their soakaway has filled up? Then there is no option. I was in Lagos for 4 days. I could not go toilet because I cannot look at it and do what they are doing.
And you didn't find them for that?
No. What do? I advise them to evacuate it.
Okay.
And most at times, the landlord will not be there. But it is not the duty of landlord to evacuate a soakaway. This is by law. Landlord can provide the facility, the structure, construction of soakaway pit is the duty of landlord. The tenant or occupier is their responsibility to evacuate the soakaway they have, because it is them that contribute to it. But when the soakaway is damaged, it's the responsibility of the landlord to correct it.
Fix it.
You see the connection now.
Absolutely.
Once you don't have a toilet, it's the duty of landlord to provide a toilet. Or in collaboration with the management, or in collaboration with the team, is a tenant. They can come together and build a toilet while they reduce it from their rent in subsequent ones. So if you look at this, these are channel of environmental factors that contribute to poor sanitation and disease outbreak. What about waste management? In fact, the environmental factors are enormous. There are many.
So now, it may seem as though from your explanations that the major reason why we're having this kind of challenge, or should I call it an epidemic at this time, is because of the environmental challenges that are, bestowed in it.
Yes.
Because if we look at some of the states that have been mostly affected, some of them are actually southwestern states and the likes. So I keep looking at this. Is there some sort of connection to all of these states where we've had these outbreaks and whether some of these deaths have occurred? Is there some sort of connection between all of them? One thing that makes them very prone to cholera outbreak?
Yes. One, there might be a water channel connecting the states. And then when the source is contaminated, definitely it will affect the end users. And that is why you see the chain from Lagos to Ogun State to Delta to Bayelsa to Cross River.
Areas.
Just the riverine areas. Because the actions of men during the dry season have now found their way into the body of water. And this water passes through and connected through these states. And they are sharing it together. Then people that go there for business transactions, those that have left the place to another place, might carry this thing. And that is why in some cases you see it here in sporadic areas. But now it is an epidemic. It is now we are facing it. But this cholera has been with us. Yes, it has been with us. when a friend of mine called from Lagos, see, I am having these difficulties. So we're talking on phone. Before you know, he say, you want to go to toilet. I say, guy, what's up? What is happening to you? He say, since yesterday, he was referring to the salary rise.
Oh.
I say, if you keep on referring to this salary rise, you are going down.
No, but there are some situations where people tell you, not just people, if you eat excess of some food, eat excess of ram meat, you could, you know.
It is still part of it. If you do not
control
your appetite.
Associated to cholera? No.
No, it does not associate to cholera. This is as a result of overfeeding.
Okay.
You understand? You see biscuit, you shop, mineral, take kunu, take zobo, take rice, salaram come. You join everything together.
Yes, we say there's no money in
that one
Nigeria.
will overwhelm your intestinal canal, and definitely you must reduce it. And that is why you keep on visiting the toilet frequently. So these are some of the things. The waterway interconnected with other states, and that is why you see it flowing like that. And it keeps going unless we control the source. When we look at the source, we can be able to control the end point of it. And many of us, we are all focusing on the water the rain that fall. How many of these facilities has done what we call water treatment? Yes, it is expected of water board to treat the water sources that is meant for the community or the public frequently, at least every 3 months. Now, when last do they treat the water? If you go to pure water factory today, you see a growth of algae, bacteria around their tank, around their premises. What happened? Those things can find their way into the body of water. And once that is done, what happened to the end users? Will be affected. So there's what we call water treatment plant, starting from the screening, and this might be from the dam or from a surface water that is controlled into a machine. Yeah. So from the screening to coagulation to sedimentation to treatment plants, that is how it go. The channel go. Then in all of this, there's a period of chlorination. There's a period of putting fluoride into the water to reduce or kill any other aquatic lives in the water before it gets to the final users. And then continuous monitoring of this exercise should be done so that people should have the right water to be used, especially at this point in time.
Because you talked about water, so let's touch on water a bit, because you just said how many times do they sanitize the water that people use and all of that. So what's the best way to take care of the water that you consume, you know, in order to stem this outbreak? Because right now, everybody is doing anything, and you find families, in fact, even putting themselves more at risk. You find them drinking a lot of concoction in the name of drink this one, drink that one, you feel better. They tend to even drink things that are not hygienic, which means that they can even put themselves at more risk. So let's talk about the place of, you know, clean water and ensuring that what we consume is actually very healthy.
Now, that is why at this point in time, people should take what they know. Drink the water you know that is okay. Now, if you take water that you do not know the source, it automatically affects you. And at this point in time, if your source of drinking water is from open space or from the pipe-borne water, it is expected of you to boil the water. Boil the water and then store it in your fridge, so that when you want to take it, you take it from there. Then, in some cases, you use what we call a water guard to treat the water before you consume it. Then, in some cases, you add a small little chlorination into the water before you can use the water. Then drink water from the source you know. If you do not know the source of water, stop drinking it. Many of these waters have a fake water sources. And what I view something sometimes ago, and people were the source of their water is from a stagnant water.
Okay.
That is, they dig something within and channel it into the machine and be using it to produce pure water. You see some pure water, you see some settle of dust under the water. How does it get into the water?
In fact, I've had people take water in traffic and they cannot even get to their destination. They have to use the restroom.
That is it, because you do not know the source of water, and everybody can do anything. People can do anything to get money, and that is why you see it. Drink water from the source, you know. I hardly eat on the road. Even if it take me 24 hours to reach my destination, either I carry my food from house or I maintain like that till I reach my destination.
In fact, I think the minister also warned that people should avoid kunu, zobo, and the like. So I figured it had something to do with water.
Yes, it has something to do with water. Even now like this, it is even expected of everybody to cook by themselves. If you can do zobo by yourself, because you know you are the one preparing it, do it by yourself. It is not even important for you to go to occasion and start drinking or eating anything at this point. Do everything you can do by yourself, because once you are doing it by yourself, you take cautious, you take precautionary measures at all stages of cooking to ensure that you do not cook or take contaminated food and water.
You see, the place of that water is just something that's very scary, because we still can't do without water. And there are locations where water is even very scarce. So which means that every source of water they find, they just feel like we can just take it and purify it. Some people believe that if you purify your water with alum, you are safe. What about that? The
alum settles the particles or other things, and has limited this to kill the aquatic lives in the water. But the addition of chlorine can help in reducing or killing or kill the bacteria that may find themselves in the course of the settlement. So that is the best way to go. I could remember gone are those days in one of the villages I visited. They have a surface, a water like this that is not flowing to anywhere.
Dam.
Yes, it's just like a dam, because the water is coming from the ground.
Okay.
But everybody in that community go into the water and fetch the water. Like
enter inside the water?
Yes. Everybody, when you are coming, they remove their slippers somewhere and walk into the water. Some people may have injury on their leg, walk into the water. Some may doing their especially the ladies, doing their flows, still walk into the water, and everybody drink from this source. You see it. So if you do not purify your own by maybe addition of alum and then chlorination or fluoride, it will help to kill the aquatic lives. It will help to kill the germs in the water. And once that is done, then water become safe for you. But too much of alum affects the flow of the water, because you'll be feeling the taste of the alum, and then it gums the
But how safe is it to even consume alum,
That is why it is not
in its raw form.
Yes, it is not safe to consume in raw. But when you add little quantity of chlorine into this water, there's no point of adding the alum anymore. Okay. You understand? So, but the country we are in is already improving in that aspect. It is only on few occasions that you go to villages, typical villages, that they do not have water, and any availability, any water they see is what they dwell on. That is what they take. So we advise them to get chlorine and then add to their water before they drink.
At this point, I feel like this issue of cholera outbreak, the responsibility falls more on the shoulders of you environmental health officers, because the bulk of the work seems to be on your table to enlighten the world and let them know the reason for the outbreak and the ways to stem it. You have that chance today. Please give us understanding of how best to stem this.
Now, in stemming this, just like you said, it is my duty as an environmental health officer to go into the community and enlighten them, especially at this point in time. That is public education. And that is one of the reasons why we are here today, to sensitize the public on the need to take water from the right source. It is also my responsibility to collaborate with other sister agencies like Ministry of Health, Ministry of Environment, NCDC have given a guideline, and Ministry of Environment has given a preventive measures. They have come online to do this. So it is my duty now to take it to you and also educate you the way it is. Now, everybody, all hands must be on desk. In Hausa, we have translated these prevention and control measures of cholera in Hausa, in Igbo, in Yoruba, and in other languages, which my people are going out to do it. On a larger scale, numerous, like in this morning, 7:30, the EGENE president, that's Environmental Health Officers Association of Nigeria, Lagos State chapter, Dr. Cyril, was on live television advocating and educating the general public on the need and prevention of cholera disease. Yesterday, the former National Deputy President, Dr. Nuhu Solomon from Kogi State, was on NTA in Lokoja to educate the general public on the need to do away with this cholera, how to prevent it. Personal hygiene is the key. Environmental sanitation is the key. These are the things we are preaching. Then we use that opportunity to also communicate with the local government that sanitation is a responsibility of everybody. They should not monetize the things that concern sanitation. Like, if you come here now and the place is dirty, you should not charge me for the place is dirty. What are you helping me to do to make sure that the place is clean? Educating you, that is by giving oral education. Do this within this certain time. I'm coming back to see how best you have practiced it. You see it. So by so doing, you see that a lot need to be done by us. And as an environmental health officer, we are not many. Go to all the states. We have not less than 4,000 unemployed EHO. Some have gone into kunu sellers. Some are doing shop provision stops. Some are doing cloth business and thereabouts. They should be called upon, especially at this point, to collaborate with the local government. They should engage them to do this thing.
In fact, we're definitely going to talk more on that, especially looking at the strategies that can be put in place, to stem this outbreak. All right, viewers, I'm sure you're enjoying the program. We would be right back. Stay with us. Welcome back, viewers. We're still discussing cholera outbreak and the environmental health challenges that it poses. And we've been discussing with Sanitarian EGENE TIJANI ENEOJO. You're welcome once again.
Thank you for having me.
All right, before we went on that break, I know you were talking about some of your colleagues that have gone to different fields, to do other kind of businesses and all of that. But this is the time when we need everybody's hands to be on deck to actually, look for how to stem the tide of this cholera outbreak, especially this season that very soon students will be on break and they will be available to play and have access to a lot of things. It's their long break, which means that if we do not find a solution to this, it might spread beyond the places that we thought. And before we know now, we'll start considering probably a lockdown because there's a big issue in our hands to deal with. Now let's talk about community-based strategies that can be used, to stem the tide of this cholera outbreak so that it stops spreading like wildfire. Because I definitely know that when it comes to health, it's a collective effort. So let's get your thoughts on what we can do collectively as a group of people.
What we can do collectively in terms of community-based strategies, we should look at the sources of this problem. It has been traced to water, yes, water and food. Then people should drink water from a reliable source, or boil this water before they consume it. Then testing is already going on to determine the number of the volume of the bacteria in this water. Then treatment will follow. Now that you know that the source of this cholera outbreak is from water and then food and poor sanitation, what are you doing? Parents should start inculcating the idea of sanitation practice into their children. That has to be done from home. Once you are doing it, you are washing a plate, you call your daughter, come and see how to wash plate. If you are sweeping the room, you call on her or him, come and see how to sweep room, come and see how to mop, come and see how to wash toilet. Because many people do not even know that they're supposed to wash toilet. You make use of toilet 1 week, 2 weeks, 1 month without washing. Don't you know that bacteria are growing there? Then poor sanitation is another problem that community has to be involved. Recently, the Ministry of Environment, in celebration of this year National Environmental Sanitation Day, which will be on Friday, that's every 28th June, is meant for National Environmental Sanitation Day. We were in Piwe community, one of the community in Abuja here. And then we sensitized the people on the need to do sanitation, on the need to get involved. The community were so impressed for finding their community worthy of this year exercise. Then at the end, sanitation equipment was handed over to the chief of the community, and the community volunteers is already set. Committee for sanitation is already set for them to continue this exercise, and not because of this celebration. And they are very happy, and they have set that standard there. Last year we went to Kushigoro along the airport route, and then we do the same. Now, their sanitation, every month, everybody close their shop to exercise that sanitation day. And not just to close your shop, you must participate. And once you finish, the truck will come and pack it away from you. These are community approach. Let them get involved, because this issue starts from community, and community must put their hands in collaboration with other stakeholders to ensure that this exercise is done. Once you see somebody pooping or sitting down or bending down to defecate in the open, in the gutter, in the classroom, on the road, tell the person to stop it. If he doesn't stop it, let that person be arrested and take to police or vigilante. We have community security help, that is a vigilante group that can help in containing these issues. So once the committee head or anybody find you defecating in the open, you should be arrested, and then the security should keep you for some time, so that you should know that your action is bad. Do you know that when you go into the bush to defecate, the moment you squat, if you come there will be no flies, there will be nothing. But when you come out and the tip of the feces come out, flies come from nowhere. Do you know why? Flies have high sense of smelling, and that is where you find them. Anywhere there is smelling, anywhere there is odor, that is where you find flies. So once you notice that, flies take that germs from you to kitchen, to food, to water, and then it becomes a problem. So flies are traced to be a mechanical carrier of these vectors. Yes, carry these germs on the body, on the hairs, and then on their leg, and then perch on your food, and you enjoy yourself. Then cockroach has also been traced to carry germs and these bacteria on their body. From the toilet, they go into the soakaway, come out, and then be moving around your premises, dropping these germs systematically. Some persons, when their food fell down, they pick it and take it too. Raw like that, without knowing what you are consuming. So these are community best practices that we should all do to control this cholera outbreak. All hands must be on desk. Take water from the source you know. Boil your water, cook your food thoroughly before you consume them. Leftover food should be covered. You should not leave your leftover food uncovered. Yes, so these are some of the things. Then treatment, water treatment should also be adopted. Then people who have public toilets should be able to channel their pipe into the soakaway pit, because a lot is happening in that sector. The reason why for public toilet is to help in curtailing this open defecation. But now going around, if a public toilet channel their own toilet from soakaway into the drainage, what is the importance of it? So all the public toilet owners must know that channeling of public toilet into the public drainage is an offense. And I'm challenging my colleagues who are in the primary local government areas to close down such premises. Once they close down the premises and allow the man to or the owner of the premises to pay heavy fine to the government, then you see that will serve as a deterrent to others. So these are some of the community-based strategies to adopt in containing this cholera outbreak.
I know that while you were explaining some of these approaches, you talked about visiting, for instance, the place you visited and give them sanitation materials. But the question is, do you go back to see how well they are implementing these things? I remember there's a cluster of community that I saw the people in a clustered place that I went to one time. And I think I told you about it. I told you what the environment looks like, and it was really, it wasn't something to write home about. But then I heard that they've had helps in that community over and over again. But it's almost more like once it comes, some people just feel like whenever palliatives or anything comes to them, it just goes to maybe things that they sell and then turn the money into something else. They do not feel the necessity to use it for the community and all of that. But so that's why I'm asking, do you take the time to go back, do some sort of monitoring and evaluation? No. Because those are the things that, you know, causes even more problems, because people just feel like nobody's actually going to go and check. It's more like they see it like national cake. Let's eat it and
let's
go.
enjoy ourselves.
Exactly.
Now, we go back to monitor the exercise once in a while, because at the end of setting this committee, it is an environmental health officer that will head that committee, who will be in charge of that community. So every day, like I told you last year in Kushigoro, if you go there now, you see that anybody you ask will tell you that every last Saturday of the month is sanitation there. Nobody comes out until we are done. So those who fail to come out will be arrested by the community vigilante.
Okay.
Yes, your shop will be locked until you pay a certain fine before you can be released, because many people are playing a deaf ear to sanitation. Like the place we went now, another environmental health officer is appointed to monitor the exercise of the community. So once they gather their waste, a truck, because it is a collaborative effort from Ministry of Environment to state, that is Abuja Environmental Protection Board, and AMAC as the area council was used as the grassroots. You see it, APB, that is Abuja Environmental, brought a truck that packed all the waste that very time.
Yes.
So it is expected of them to also do this. Once they gather, they have set out a place where they can gather their waste. Once they gather their waste there, the truck from the state will come and pick it up and dispose it for them sanitarily. So these are some of the approach that we should do. And we do this monitoring as well to ensure that people continue to practice this. Those who fail to do it, the community, we are living within the community now. That day, there are people that refuse to close their shop. We help them to close it. Yes, and then they go to Chief Palace to collect their key. And that is because we come there for the purpose of enlightenment. If you refuse to obey the law, you refuse to obey the chief of the community, that means you are not obeying even your husband at home. That is the simple interpretation of that. If a chief of the community has given instruction and every other person is closed their shop, but you refuse because you claim that nobody pay for shop for you, then we help you to close it.
Because honestly, health is our collective responsibility.
Yes.
We cannot afford to just ignore. Now, part of the things you touched on is, you know, clean water, maybe appropriate toilets because of open defecation. So is there a role that maybe some of these public infrastructures can play, you know, to help to curtail some of these things? Maybe government needs to put some things in place, especially for communities that do not have access to clean water, those that do not have access to proper toilets. You know, maybe there are some of these interventions that government and maybe some non-governmental organizations can come in as intervention to support communities.
Yes, governments need to do a lot. Just like the FEC, the president of the country has given an instruction to Federal Executive Council.
Yes.
To take care of this cholera emergency as a case may be. So those people now have to go into action. And on this note, I want to also advise that the president can appoint a seasoned sanitarian as special advisors to the president on sanitation matters. When it comes to sanitation, everybody believes they can do it. Yes, like they can give the guide. But there are people who studied the course core. You can't just come and defend somebody in the court if you are not a lawyer.
True.
That is how it's supposed to be. No matter how expert you are in speaking, in public speaking, you cannot be called to be an MC of an occasion unless they have seen you doing it before, they have seen you giving a guide on public discussion. So people look for the best MC to anchor their program. So why not look for the best sanitarians to be special advisor to the president on sanitation matters? If that is done, from there you see that you have direct information, not what this person say, this person say. Everybody want to keep their job. Depending or dwelling on some of these informations is why we are here today. Preventive has been suffered a lot. They focus more on curative aspect. And once you do that, you will overwhelm the facilities in the hospital. You overwhelm the doctors. And the end point of it, come back to the community. It is established that 75% of disease affecting us in Nigeria and Africa arises from poor sanitation. If we can control poor sanitation, then we should know that we are instead of spending too much on curative aspect, people can use that money to do other things. How much has been spent so far in this cholera outbreak? Something that common treatment of water can control. Something that enlightenment of the general public can do. So government has a role to play in collaboration with other stakeholders. NGO has a role to play. But the burden should not be left alone for the NGOs. NGOs should be in support, not taking the lead. But in some cases, government are depending on NGO for information. Where are we going to? If we go out and find out this, bring a data to you, how do we control it? Let's do it direct. I was listening to somebody on a kind of a program. He bring a long bread I want to share for people in the community. Presented it to the leader cut his own. The next person cut, the next person cut. Before you get to the last person, you see something that remains tiny. That is how it is on our national budget. Before this one take, the problem has not been solved, but they have shared this money within themselves. If they like, let them remain with the problem. And that is why we remain with the issue. So preventive medicine is the key to all these diseases we have crying about. If you take it seriously, by engaging people, the right people, it is not only environmental officers that do the work. It is a collaborative effort, but they take the lead. Educating the people, serve them a notice on what should be done. And once that person did not do that, they have the right of entrance from 6 a.m. to 6 p.m. and any other reasonable hours for the purpose of abating a nuisance, inspection of nuisance, detection of nuisance. And once that is done, you give instruction on what should be done to correct that problem. It is not a revenue generation office. It is to correct and strengthen the health system.
Honestly, whilst we're also looking at strengthening the health system, let's also look at the role that Nigerians get to play in this issue on ground. So I want to get to know the kind of reactions that people give you when you go to them, especially trying to enlighten them on what they need to know to stay safe.
You know, see, me personally, I want the right thing to be done. And we have so many sanitarians, environmental health officers who want the right thing to be done. We went to a place recently to inspect the facility, public toilets. These public toilets channel their soak-away pits from channel their pipe from the soak-away into the public drainage system. This is not even the one I saw this morning as I was coming. But when we contact the owner of the premises, he asked the boy to give us 10,000 and forget about the problem. I was like, what? How on earth will you advise that you should give us this and let us leave the problem like that? We give the man 3 days to to remove that pipe and channel the pipe back to the soakaway pit. You see what the challenges we face.
Exactly. That's why I was asking you, what kind of reactions do they give you when you go out there to talk to them and enlighten them on what will benefit them?
Yes, some know the problem. Some know the problem and they want to be solved. Recently as well, a man, when the soakaway filled up, he channeled another pipe from the soakaway to the gutter. And then this thing was disturbing the neighbor. The neighbor cried out. When they came to meet him, the neighbor came to meet him. He said they abused him, and that is why he left the problem undone for 6 months. So when I was educating the man, he said, because you have come to educate me, I will correct it. But left alone, those people will continue to suffer it because of their manner of approach.
You know, that reminds me of a story that I heard, that a landlord and his tenants were having a challenge. The landlord quitted the tenant refused to leave. And then the tenant has issues because the house is very old. So the landlord has issues with the tenant's toilets, and they needed to fix it. But because the tenant is so adamant on, I am not leaving this house, I am not leaving, the tenant literally locked the house for I think a year or thereabout, to the extent that they could all perceive the smell was disturbing the entire neighborhood. The tenant was not willing to also leave. In this kind of case, what should have been done? Because now court says just wait till the exact time the person is going to leave, but the person feels like, I have a right to this house until that date that I'm expected to leave. Now
the thing is, in landlord and tenant matter, it is also part of the work that we can do.
Okay.
Now, landlord cannot wake up and tell a tenant to leave his house. There should be time. First might be an oral notice. Then after that, you have the right. This is legal now. You have the right to spend 3 months in that premises without pay. After that 3 months elapse, you come back again, you give him 1 month. After that 1 month, he is entitled to 21 days, that is 3 weeks. After that, he is entitled to 1 week. After that 1 week, he is entitled to 1 day. After that 1 day, the enforcement team from the judiciary, because this is through a court process now,
of course,
have the right to come and send the person packing.
So what if the person's adamant character is creating environmental pollution?
We have the right to arrest the person, and make sure that he do the right thing. Environmental health officer has power of entrance, power to seize, power to close, power to arrest, and power to prosecute.
So where do you prosecute these people?
We prosecute this in the magistrate courts. We prosecute them. We have a mobile court that's come to, if you do not want to come, maybe this whole community are gathering to do this and we have tried to correct it, they do not, then those that refuse to do will bring a mobile court to your doorstep. As they charge you, if you can pay, you pay, go back and correct it. If you cannot pay, the vehicle is there to take you to Suleja, or where you can have your mental health relaxed for some time. You understand? So we have this law, and that is why we are calling on government to help us, to back us up, because we don't have the number. We have the number of unemployed EHO, but the ones that are engaged are overwhelmed. So these are some of the things. We have the right to arrest the person, detain the person until the right thing is done. And we also have the right to do the thing. If the person is play adamant, we can use our resources to do the thing while the person pay fine for it. If you do not pay fine, we can seize any of his property in exchange for the money spent in correcting the wrongs in the environment.
Absolutely. So now I'm thinking, with this explanation you just gave, you mentioned that you went to Kuchingoro. Kuchingoro, I believe, is a part of Abuja.
Yes.
So is there a situation where you guys have pushed for, let's have a general sanitary day in the FCT? Just like in Lagos, people know that the last Saturday of the month, you don't even go anywhere till 10 a.m. But it's not like that in some states.
Yes.
And talking about the Federal Capital Territory, should that last Saturday seem like a lawless day, that people do not even understand the fact that sanitation should be done? Because if we want to stay healthy, we must pay attention to our cleanliness, healthiness, and everything in the environment.
Now, in response to this, I think in 2016 or thereabouts, the sanitation issues, monthly sanitation stopped in FCT for the same reasons that politicians or those wealthy people who are traveling may not have the opportunity to travel. Many people miss their flights, right? And as a result, they sit on it that this cannot continue. Yes, because it affects them from movement, right? Now, when the current minister take over, he says sanitation will come back. We are still waiting. What we do as a professional, we have written when we came into office. Recently, we held our association election, where I happened to be their financial secretary. So when we came in, we have written to the Office of Minister for Courtesy Visits, and one of the things we want to discuss with him should be the bring back of monthly sanitation in FCT.
Beautiful. That's really encouraging. Now, I've also heard that cholera has vaccine.
Yes.
How well is that? How accessible is that?
It is accessible, but the mentality of our people, nobody want to take a vaccine. Maybe from their previous experience. So when I work at the airport, we see a lot. You see a family, COVID vaccine then was not meant for children.
Yeah.
But you see a family of 10, everybody, even the mama born yesterday, carry COVID vaccine. How come? So we started tracing it, and then it's
discovered that most people didn't take it.
They don't take it. You understand? They don't take it because they do not believe in it.
All right, so we know that cholera, this is not the first time we're having cholera outbreaks here and there. What are the long-term strategies to mop this up, that we do not even, at least let it just be something that comes and ends once and for all? What is it possible for it to come to an end once and for all? And what are the long-term strategies that we can put in place?
Now, the cholera can be stopped.
Okay.
And not only cholera, typhoid fever, malaria can be stopped if only we have we take into seriousness the sanitation issue. Poor sanitation is the major causes of all this problem. If we can take sanitation issue very seriously, everybody clean your environment. Those channeling their pipe from the soakaway or from the bedroom into the gutter should channel it back to their soakaway pit. You see that rain, even though rain did not fall, you see water flowing from where? Then sometimes it might come from water board, the breaking of pipe. Those in charge should be able to fix it as at when due, so that we do not have stagnant water that can lead to malaria. We do not have a poor sanitation that can bring about cholera or typhoid fever. So poor sanitation is one of the critical things to be done to ensure that we control this. And then water treatment is very, very key. We should not just drink water that we see. How effective?
So I want you to also take the advantage to advise our viewers as we wrap up the show. Yeah.
So how important it is? How wholesome or clean is the water sources? Those in charge will be able to clean and then treat the water effectively. And to our viewers, it is an opportunity for you to ensure that you clean your environment. Not even monthly, should be done every day. Then it is an opportunity for you to boil your water before you consume it. Do not eat from the source you do not know. Cook your own food, and then when you see flies, treat it, kill it, and then do not allow it to transfer germs into you. And then make sure that you take your personal sanitation very seriously. That is your cleanliness, your hygiene. Your personal hygiene is key. So in doing so, we will be able to mitigate and control this cholera outbreak. You have a role to play as an individual, as a community, as a environmental health officer. I'm here to enlighten you. As government, we pray that them also should look into budgeting in environmental health, so that in all of this, we can be able to control disease outbreak, not only cholera, but other diseases that are affecting our continent.
Thank you very much. Really appreciate you, Cholera Tijani Eneo. Really appreciate you, Environmental Health Officer. Thank you so much for today.
Thank you, Ma.
All right, viewers, I'm sure you've heard from him that cleanliness is very important. You have to take care of your environment at this time, especially in this rainy season. We must work together to make sure we stem the tide of cholera. Thank you so much for watching. I am Olamide Al Hassan, and I'll see you again next week. Bye.